Good afternoon, and welcome to part 2 of our 3-part series of Quickeners for nutrition counseling for the registered dietitian. Today we will discuss best practices. On behalf of the National Resource Center for Nutrition and Aging, we thank you for being here today. To give you a little bit of background about me, my name is Jocelyn Evans. I'm a registered and licensed dietitian. I'm also certified in gerontological nutrition. I'm currently a consultant dietitian with the National Resource Center for Nutrition and Aging. I have 5 years of experience working with the older adult population, both in long-term care and the community setting. First, let's discuss the initial nutrition counseling consultation. Your first step is determining your location. Some of the preferred sites for consultation include the Area Agency on Aging office, a congregate meal site, or perhaps the client's home. If another location is used, ensure there is privacy for the client. Telehealth may also be an option, specifically for rural clients. Next, let's discuss scheduling. Online platforms may have scheduling options. Your Area Agency on Aging can post on its website a direct link for the clients to make an appointment. Posting this link could also be a way to advertise nutrition counseling online. If a referral is made, the dietitian should directly contact the client to schedule an appointment and arrange to obtain any necessary paperwork prior to the consultation. When scheduling the consultation, educate the client on what to expect next. Necessary documents via mail or email. Explain the potential need to also contact their primary care physician or the referring specialist. This is especially important if billing for Medicare is an option. The next things would be to determine what type of pre-visit data you would like your client to share with you. The first would be any medical or diet history. This can be taken from the client and also could be from the provider. Goals. It's important to note this must be done by the client, either before the consultation or during. Any insurance or billing information, if your organization would like to pursue that avenue for revenue. A consent form, cancellation policy, if necessary. Any lab or exam results that the client would have. A 7 or 3-day food journal. Primary care provider or referring specialist contact information. Again, this is important if you are planning to bill insurance or Medicare. To obtain this data, it's recommended to mail a packet for the client to complete prior to the consultation. Another option could be an online form for the client to complete. The packet can also include appointment information, such as the location of consultation, directions on parking, time and date, and also items that the client should bring with them. Next, let's discuss a potential structure for your consultation. If you plan for 45 minutes for the consultation, the first 5 minutes should include small talk and building rapport with your client. The next 10 can be a discussion on challenges, another 10 as a discussion on successes, the following 10 to 15 minutes spent on a nutrition plan, 5 or so minutes on a goals review, and the last 5 discussing the next appointment and what for the client to expect next. During the consultation, it's important to practice counseling skills and active listening. Be sure to go through the goals with the client. Establish a plan for subsequent and follow-up consultations. It may be a good time to book the next appointment. Post-consultation, it's important to send an email or letter to the client after the consultation. You can discuss any resources, a recap of your discussion, goals, and details about the next appointment. Be sure to schedule time in your day to complete the necessary charting. Send a fax to the referring provider if necessary, and also completing your billing and send if necessary as well. So let's reiterate some of the things we discussed earlier about referrals. If you are planning to bill Medicare or any other insurance, you will likely need a referral from the client's provider. A referral will indicate the client has the appropriate diagnosis for reimbursement and any other appropriate diagnosis for nutrition evaluation. This referral documentation may also be an opportunity to obtain any medical information directly from the provider. Post-consultation, it's important to determine an online platform to use for your charting. Consider ease of sending information to the providers. The nutrition-focused physical exam. Research has shown that early intervention of a patient with malnutrition can decrease overall healthcare costs and improve the quality of life for the patient. Dietitians can perform a nutrition-focused physical exam to more accurately provide individuals with a malnutrition diagnosis. With the research proving this exam to decrease healthcare costs, it could also be an area for reimbursement with insurance companies. This should be an important part of your assessment. If you have more questions regarding this exam, the Academy of Nutrition and Dietetics has a great hands-on training workshop included on their website. Another important thing to consider for your consultation is utilizing an online platform where the client can journal food intake and also communicate with the RD. It's recommended to have a minimum of 2 follow-up consultations after the initial because the client will have a higher likelihood of long-term success with an increased number of follow-up consultations. The average time between nutrition counseling consultations should be 2 to 4 weeks. This concludes part 2 of our 3-part series of Quick&Rs for nutrition counseling for the registered dietitian. Part 3, we will discuss telehealth and marketing. Also note that this information will be included in a PDF form on the National Resource Center for Nutrition and Aging's website. See you for part 3.